Hello and welcome to Unlocking Health with Dr. Alexi. And today I have my good friend Karan Almond here. Karan is an oral systemic consultant. You specialize in dental detox and all of the symptom complexes that go along with the need to excrete toxins in our bodies. And Karan, I'm always happy to have people here, but you and I get along so well, and we think so similarly about everything that we do. Um, I've been talking on my Facebook groups about the impact of mercury and amalgam fillings on their overall health. And although I have a great understanding, you are the expert, so I really wanted to bring you in to go over that. So welcome.
Thank you. I'm glad to be here. And that term expert gives me the willies a little bit because I don't know, I don't think of myself as an expert, but I'm an experiential expert, not an academic expert. I guess that's how I'll put it. So when I experience something and it forces me to learn, that's where my, passion and expertise comes from.
Right. Well, we're going to dive in today and talk about amalgams. So, can you explain to people what amalgams are?
Yes. I could give you one word that probably isn't appropriate to say here. Um, so, most people call them silver fillings because when we first get them and we look in the mouth, they're silver. But over time, they actually look black. So
Mhm.
people still often refer to them as silver fillings because they were once silver, but they turn black because they become corroded. And we'll talk about that and how that happens. And when amalgam fillings first came on the scene, they were really the best we had for holding the structure of a tooth together once, it started to decay. And like with everything in conventional health, it's always, well, what thing can we do to fix it? And we kind of are learning now that we need to look under that thing and we really need to get to the bottom of what's causing your decay. And most people think because we've been told that it's sugar in the mouth, but actually it's really diet relative to carbohydrates and that turn into sugars. And there's something called a dental fluid transport system. And there is a very strong, most people know that now that the gut biome and the oral biome are connected, but there's actually this pathway where these sugars go back to the tooth. And so there's a couple of things to be aware of that people may not know where decay is concerned. It's not always the brushing. It's your diet, but it's also your minerals. If you are low in phosphorus, it will reverse the flow of fluid that is supposed to go from the interior of the tooth to the outside of the mouth or in the mouth. If you have low phosphorus, it can reverse that flow. And so that brings bacteria more into the tooth. And the body is just so amazingly brilliant to me. And you have this tooth structure that has enamel on the outside. And when you get a little bit of decay in there, we know now that you can actually stop the progression. People talk about reversing cavities. I'm not saying it's never happened because I think we are empowered to heal our body without all these things. But for the average person, they're not going to take the time to do what they need to do, the work it takes to reverse decay. So
Right.
you can stop the progression of it by using some minerals. And there are some products that I can share. But once you have the decay, if it's in the enamel, you can stop the progression. But once it gets into the dentin, then you need a filling. So the amalgams came on the scene. They're about 50% mercury, and we can get into that and what mercury, how it behaves in the body and all of the things that it causes, which I learned the hard way. And the rest of it is like tin, nickel, aluminum. So there's other metals in there. So when you put one of those fillings in a tooth, it's a liquid that actually gets poured into the tooth. So the dentist will take the drill, he'll remove the decay from the tooth. but they have to actually undercut the tooth so that it's smaller on top and bigger on the bottom. And then they pour the liquid in and it hardens. And the reason they do it this way is because the amalgam does not knit to the tooth itself like a composite filling does. And so they have to undercut it so that that amalgam doesn't slip out, and you lose your filling. And so it takes away more of the interior structure of the tooth, especially if you have a deeper cavity. And then over time, what happens? Several things happen. So in terms of the mercury exposure and the metals, when you have friction, just a little bit of friction from chewing, from clenching and grinding, from having hot liquids, you get in a sauna, you heat your body up. All of that will cause what's a vapor to release. I should have actually pulled it up so I could screen share and show you, but I can also put it in comments if anybody wants to see it. But it's a picture of a tooth that was extracted and it has amalgam in it. And they're holding it in front of a green screen and they just take a little eraser and touch it to the tip and you literally see the vapor coming off of the tooth. And it doesn't stop. It's not like it ever stops. The mercury is always there, this vapor. So you're getting a constant, I don't know what to say, download of these vapors throughout your body. And they go into the cells, into the membranes. And so there isn't an organ system really that is not impacted. That's going to depend on your genetic weaknesses and your potential for certain diseases. Right. And it disrupts a lot of pathways in your body, including your detox pathways. So that's why the vapor is an issue in the body. But the other issue is structural. And so these amalgams, when they heat up, they will expand, and they get cold again, they will contract.
Is that why teeth crack with them in there?
Yes. Okay. And especially the molars on the teeth where you have lobes, it will push the tooth apart and you can get a lot of hairline fractures, and you can even see the fractures in an old mercury. Once that starts to move apart, you have space for bacteria to come in. And when we take these amalgams out of the teeth, it blows my mind what the tooth looks like and how much decay is in that tooth and that they can be saved.
Right.
So sometimes I have clients come to me and they say, well, you know, I went to get my amalgams out and this stupid dentist wanted to put a crown on my tooth. I think he just wants money. Well, I can't say that is never the case, but I can tell you that the dentist I trained with, I know has the integrity not to do that, but he will recommend a crown when the structure, the walls of the tooth that's left is weak. If you put a composite filling in there, what happens, especially if you have a higher bite in one area and you grind or you eat a lot of nuts and crunchy foods, you're putting more bite force on that tooth that's weak. And worst case scenario, you get a crack that goes all the way through the root and you lose the tooth. So I have people who also come to me and say, I had my amalgam out and then I ended up losing the tooth. And so that tooth should have had a crown. And there's various levels you can put a composite in if the tooth is strong enough. There are times that you may not need a whole crown. You can have like a zirconia lab created filling. An impression is taken. And so it's just like a composite, but it is a little bit stronger. So sometimes they can use an inlay or an onlay. But a lot of times if it's a molar and it's more than half the tooth is filled, kind of wise to go ahead and spend the money up front and have the crown put on. Because if you lose the tooth, and then if you have to replace a tooth, that's a way more expensive than a crown.
Now, and this is getting maybe a little bit off topic, but okay, so if someone has mercury fillings, some will have mercury and gold fillings. And I know the two metals together cause like a galvanic response in the mouth, and it's even more so toxic. So when would a doctor have decided to do mercury versus gold or put both in? I mean, was it just difference in techniques over the time that changed, or?
Yeah, I don't know if I really know the answer to that,
Right.
but I know that there are some people who ask for gold. They want the gold. Gold is actually, if you're going to have to put a metal in the mouth, gold or stainless steel, like a lot of people who understand mercury toxicity, and there's different appliances and things that have stainless steel. You don't get the same effect from that as you get, unless you're somebody who's highly sensitive to stainless
Right.
steel. Something called a biocompatibility report, blood test you can have done, and that will look at the metals that you're highly reactive to. When I was working in the dental office and reading those reports, I saw a lot of nickel, aluminum, titanium, and mercury. Those were the things that were most high collectively. And basically, all of those things are things that are put in the mouth.
Mm-hmm.
So when you're talking about the galvanic response, kind of funny story. I used to think I was really special because I had my first amalgam in baby teeth. So I got them very young. And from as early as I can remember, I used to see these little sparkly things in my peripheral vision falling. But when I would look at them, they would go away. They almost looked like water drops or something that was sparkling. And then I would hear radio stations, distant radio stations. And I'd say, can you hear that? Like somebody singing, and nobody could hear it. And this went on for my childhood, a long time. And my grandmother would say, oh, that's just angels. You're just hearing and seeing angels. So I thought I was really special for a long time. And then
Mm-hmm.
my amalgams removed, and turns out I'm really not that special. I don't see it.
Did you see those all? Because you got them removed as an adult, correct?
Yes. Well, I had some that had to be replaced, but they put mercury back in them. So I went through the whole thing of having them drilled and being exposed to all that vapor without protection. And then most of them, I had a total of 14 amalgams. So I had a lot of teeth that were affected with amalgams. And when I was in my 30s, I actually started having them taken out only because of vanity. I have a big wide open mouth when I laugh. And so those half of them were not taken out under any protection. And then when, of course, I was in the biological dental office because I had a gazillion root canals and I was very, very sick and disabled, the first thing we did was remove the rest of the amalgams. And I want to talk a little bit about that too, because even though I had been a nurse, even though I had been very sick with other symptom complexes, even though I kind of knew how bad mercury was for you, because there are not a lot of people who know how to properly chelate that, I had so many horror stories that I decided it would be better if I just allow my body to naturally detox it rather than trying to force it out.
Right.
And was that a good decision or a bad decision? Probably neither. It was a learning experience. But what I learned in 2019 when I entered a study was that I was way more heavy metal toxic than I believed I was. And so when I had them out, I had other things going on. It's kind of too much to talk about here, but I went through a lot of teeth extractions and 31 dental surgeries. So I really, I did a detox right before I did all those extractions. And I was no longer walking with a walker or a cane. I felt like I could work within 12 weeks. I went back to work for the dentist that I believe helped save my life, honestly. And so I was feeling so much better that I wasn't eager to disturb any metals and push myself.
Right.
But over that a course of like 7 years, what happened was I was spending a ton of money chasing downstream toxins. And so I was feeling good. I felt like I was overconfident. So in 2019, my old Lyme disease doctor knew that I had always wanted to check my glyphosate levels, and we had just never done it. So he asked me if I would like to enter this study with a fairly well-known Lyme doctor who required a DMSA challenge. And for those who don't know what that is, DMSA will help to open up these places that mercury is kind of deeply stored, and it will pull that mercury out. So it's kind of like a upstream dump into the downstream. And then they check your urine to see how much, because it's highly excreted through the urine. So they check your urine to see how much is being excreted. So I jumped at this because they did a heavy metals test, they did mycotoxins and glyphosate. What I didn't think of, even with all my knowledge, what didn't occur to me were the rules. And the rules are that I had to stop all my supplements, no binders, no sauna, no detox at all. The only thing I could do was a foot bath 3 times a week, because this was looking at what happens with the ionic cleanse. So they kind of had to design the study this way. But for somebody like me, it was not a really good decision. Right. And I did do the foot bath. I did it for 12 weeks. And so during that 12 weeks, to be honest with you, I didn't feel horrible. And I think that the foot bath was helping. I really do think there might be validity to it. But it was after that. What it did not do is detox everything. So what I actually did was I disturbed all these metals from my upstream, recirculating them. And of course, we know what happens when we recirculate them. They have to have somewhere to go, because you can't survive with all that circulating in your blood, right? So we have fat in the body to protect us. And I put on 30 pounds in 6 months.
Yep.
And I was hardly eating anything. I really wasn't eating that much. Yeah. And I started having neurological issues again. And my Lyme disease, what I thought was all Lyme disease, was highly neurological. After this experience, I now believe that a lot of what I thought were Lyme symptoms were probably heavy metals, mercury.
Mm-hmm. Well, and they sort of go together. Lyme with all of its co-infections, and yeast and candida seems to be a big issue that goes along with Lyme, which kind of hides some of the heavy metals. And so everything has got this interplay, right? And so usually it's not just one issue, it's a whole bunch of issues that all have to be tackled. So how long did it take for you to kind of go from 2019, where you kind of slid back from this study, to where you are today?
Well, this is the other thing. I take issue with protocols. Like, here's step 1, 2, 3, A, B, C. This is what you're going to do, because it doesn't work like that, because the body is so unique and we don't really know exactly where all the damage is and where it isn't. And so I actually thought my Lyme had reappeared, because we are very conditioned toward diagnoses. And, I have this thing, it's attacking my body, and I need to deal with that. And it's very oriented towards biotoxins, like, Lyme and mold are huge ones, right? Mm-hmm. So I was still doing like a lot of the detox stuff that I had done before, but I wasn't taking the binders I needed to be taking. So kind of fast forward to last year, when the dentist that I worked for wanted a detox practitioner for his practice. And, I stopped working in that office about, when was it, 2017, and started doing consulting. And I now live an hour and a half away. So, but I still refer people to him. And so I decided I would go ahead and do this detox program. It just so happened that the TCD program was, before it was a program, these supplements were available back in 2013, 2014. And I did the preparation phase and I did the body phase, the downstream detox, right before I had my teeth removed. So I really credited how much better I got with the extraction of the teeth. And we can do another video if people would like and talk about root canals, because that's a whole other ball of wax that's really important to know about. But I really credited my rapid, extraordinary response and getting my health back and being able to work with that, because I had taken so many supplements in the past. I just wasn't willing to give supplements that much credit. But I didn't do the upstream detox. And so, fast forward to starting this program, I began to put pieces of things together. Mm-hmm. Oh, I never did the upstream, and I've been spending $800 to $1,000 a month chasing the downstream. So when we talk about toxicity and we have this bucket, and the body can function with a lot of toxins on board, it actually can. And so if we're filling that bucket up, but we're not overflowing, we can remain pretty functional. And so I was chasing those downstream toxins all the time. And to be honest with you, I was getting tired and frustrated with it. I was getting tired of that much money at it and having to pay that much attention to it. And so when I stopped doing that, my bucket obviously overflowed in 2019. So of course I was doing all the things for a potential line, and did some IV ozone, and I wasn't getting a lot of traction. I was still functional, but I was starting to take naps again. I was starting to kind of have memory issues again. I was starting to have mood swings again, which for me are really dangerous. And because it's like I go outside of myself and I can see my behavior, right. And why am I behaving this way? But it's almost like there's no control. I don't have a dial to dial those feelings and how I'm expressing myself down, because my nervous system is so overwhelmed and I'm so frustrated. So I knew something was wrong. So as I'm taking the TCD certification, I started putting all these pieces together. So I decided to go back to square one, do the prep, body, brain. Did it. Great. Prep was I felt amazing on prep. I felt like I was almost back to normal. So much so that I decided, you know what? I'm not going to move into body and get these downstream toxins right now because I feel so good. And of course, I was turning my own biochemistry back on. So my body was starting to function a little bit better. And so then I went into body. I did great with that. Absolutely no problem. And then I went into the brain phase. And in the brain phase, as you know, we use ALA, and it opens up the brain and the fatty tissue, and it starts pulling those upstream deep accumulated toxins. And for me, I had a neurological, I'm going to call it an episode, and that's all I'm going to say about that. But I called one of our mentors, and she kind of talked me off the ceiling. And turns out the next day, I began to smell fentanyl and neurontin, which I thought I had cold turkey detoxed over 10 years ago. And I knew then the power of this detox. And I did get through the brain phase, but I think I was struggling because I think that I'm still so heavily mercury toxic. And because I was so symptomatic, I kind of I won't do that again, and I won't advise any clients to do that, but I forced my way and did the whole thing. But I do believe that I have a candida issue. It's probably been long-standing. I've never done a candida diet or detox because, well, I like to eat, and that's just that. So so what I'm getting ready to do right now is do a complete wipe of my biome, and then to start reseeding it. Mm-hmm. And I go back and work with these deeper toxins, which are these metals. So that's a long answer to your question, but I'm really still in the process of doing it. And the way I look at it is it's not a race. We get into this, and yes, you can do the detox and all of that, but there's not a linear progression. It's sometimes 3 steps forward, 2 or 1 step backwards, until you start to hit the support. And you know about these things in terms of how it affects the body. So, and I think you're actually more well-versed in that. So why don't you kind of tell me what you see with people and what you think is attributable to the mercury?
So what I think is difficult is the reactions through the body tend to be the same for many illnesses, many toxins, any environmental toxins, heavy metals, Lyme, breast implants, any implants that you may have in your body, overgrowth of any kind of bacteria. It all is systemic in the body, the way it responds. And so you may see things like headaches, central nervous system overload. You may be in a constant state of fight or flight with your autonomic nervous system. Your GI system may be messed up, so you may have diarrhea, cancer, constipation, all sorts of things. So the just gurgling, infections, like you said, candida problems will often arise, neuropathy, tingling, memory problems, pain, just throughout the body can be very generalized pain. So there's so many things that you can experience, and it's hard to know what specifically it is. And I think that's why you and I believe so wholeheartedly in detoxing. And the thing is that most people, when they think of detox, they've done the lower level detoxes like you did, where it helps the body. And it's great because it stops that bucket maybe from overflowing, but you're not getting the toxins that are stored in the tissues. And the body is really, like you said, it's an amazing machine, and it shuttles off the toxins and locks them into fat cells, which is why most of the people that you may see that are toxic tend to be either obese or have a high BMI rate. So you could have someone who's super thin, but is primarily fat, and they can be super toxic as well. It's not to say that someone is thin and fit is not toxic, but they're probably less toxic than someone that is obese. And so to me, the thing is there are lots of tests to study toxicity, to look at it. Some of them are there's always some information that can be gained from these tests that we use for understanding our toxic load. However, they're not comprehensive. There's a lot of false negatives. The toxins can be stored in our subcutaneous fat, our visceral fat, our brain tissue, in the organs, in the bones. It can be in the blood. So you can have an oat test, or you can have a hair mineral test, or you can do a urine or blood test. They're only little snapshots of what may be happening, but they don't get the big picture. And so I would say any test that you do, that anybody does, is going to significantly underestimate the toxic burden, especially when it comes to mercuries and heavy metals, because they really do go primarily into the brain tissue and into the bone, which is much more difficult to assess the load that you may be struggling with.
Can I interject something without disturbing your flow too much? If so, I'll come back to it. But in talking about the testing, there is one test that I do like for some people, especially people if they have known MTHFR, or they know they're toxic. Before scheduling having your amalgam removal, the test that I think that could be beneficial, it's not necessary if you're going to detox and do all those things anyway. It's kind of a validation though, and it's the quicksilver mercury tri-test.
Yes.
That test looks at hair, urine, and blood. And it gives you a inorganic and organic mercury load. And they even compare it to CDC plus their people. So you see the difference in what the CDC says and what they're seeing. But the other thing that it does is it gives you a excretion ratio, because it can look at all three of these. And what the real important thing with that test is tell somebody not your mercury load. We know you have a high mercury because you have these symptoms. Most people actually do. And even if we don't have amalgams, it's highly possible that our parent did. And if the parent has it, it's passed down to the baby. And there's other things too. There's like tattoos. My partner was raised in a print shop, and he had his hands in the inks all the time. So he had mercury toxicity. And so when we look at this excretion ratio and it shows that you have a low excretion ratio, then we know that you are a poor excreter. Mm-hmm. And so you have to approach detox with that person a little bit differently than somebody who's a good excreter. And usually they're much more symptomatic.
Right.
So that is one test that I like. I don't prefer the DMSA test if people really want it. But I think it's overkill. Mm-hmm. If you've done if you've done detoxes and you've done all of that and you still can't figure it out, maybe at that point, but I would suggest even doing something like that under the supervision of a physician.
Right.
Not with an online coach. That's just my feeling about that.
Yep. And I think you bring up a good point is if you do a detox, especially a dental detox, you want to make sure you're going to a qualified dentist. Your traditional dentist is not trained to appropriately remove the amalgams. And I believe that's going to increase the toxic load in your body. Can you go over a little bit about the difference between what a trained biological dentist is versus what a traditional dentist will do?
Yeah, so I'm also going to refer people to Hal Huggins. Hal Huggins was a brilliant pioneer in trying to teach the dental industry about the dangers of mercury fillings, because it's not just the people that are putting the mercury in. The dentists who are going to school are also constantly exposed. And we see some of the highest suicide rates in the dental industry. Mm-hmm, mm-hmm. And I have had so many people. I mean, I have a dental support group that it's not mine. There's a group of us that admin this, but we've been doing this for 7 or so years now. And we have over 1,900 members, or 19,000, I'm sorry, members. That's a lot of members in a dental support group. Mm-hmm, mm-hmm. Problems are prevalent, and the masses are waking up to that too. People are starting to realize there's something, but they don't know all of this. So Hal Huggins, if you go to the Huggins Foundation and just Google search it, you can find a ton of information on mercury and heavy metals. Now, ideally, you would want to have this procedure done in a Faraday cage that protected you from all EMFs, because EMFs are also, when I had my amalgams, I got to the point that I could not be on Wi-Fi for more than 30 minutes, or I was yelling at everybody in my house. And it took a long time, but then my family would say, every time you're working on the computer, you start screaming at people. And I'm like, well, you guys should be quiet. Well, more than 2, maybe 3 stimuli in a room would grate on my nerves. Right. So it took me a long time to realize what that was. But, you don't need to be in a Faraday cage. But seeing a dentist who is IAOMT or SMART certified, and you know what, we can put links for that too, if you want to do that.
Yeah, I'll include links below. So
yeah, so a dentist who is certified, they take additional training. They are taught how to properly use filters and various things in the procedure in order to protect you. You have some dentists who will remove amalgams, and all they do is use a dental dam and some water and oxygen. And that's not really enough. They should be soaking gauze in some charcoal. There is a whole protocol that I do, an amalgam protection protocol for people in addition to their detox. So if somebody does detox with me and they need to have amalgams removed, I'm going to want them on this amalgam protection protocol. Because, even as careful as the dentists are, you still could accidentally be exposed.
Right.
A really good dentist and a really good assistant will not, allow chunks to come out and you to swallow them, but accidents happen. And so no matter how good they are, you need to basically protect yourself with binders and encourage that metal to move through your gut, because you don't want a huge load going through the kidneys, because it's very damaging to the kidneys. And so, drinking, hydrating. We talked about this earlier before we got on, and dehydration. Paying attention to your hydration in the days before is really important. You want to make sure that your, kidneys are open, that your liver's open. You want to make sure that your gut's moving. If you haven't had a bowel movement in 3 days, you might not want to go have your amalgams removed.
Right. Because those toxins just sit there then and they just re-poison you.
Right. And it's unfortunate, but even the good dentists, they don't have the time to educate everybody about this whole thing. And I get that everybody's like, well, they should. There's a difference between should and can. And they have to work with the way the system works. And so I really feel like this whole preparation protocol, there needs to be much more attention on that. And that's been one of my goals, because over the years, I have had person after person after person come to me and go, what do? I had my amalgams removed because I thought it would help, and I'm sicker than I was before. And then we find out they're MTHFR, they have poor excretion ratios. So rather than have to backtrack, because what happens is if you get this big exposure and you can't excrete it, you're going to do exactly what you were talking about. It's going to be deposited either in the fat cells, either the adipose tissue, the brain, the nervous system, or the glands and organs that have fat. So if you've got a huge fatty liver, you might be holding a lot of toxins from the metal in the liver. So it's a very complex thing to deal with, because people are like, well, how do I know my pathways are open? And so maybe that's something we could talk about at some point, because that's a huge topic in and of itself.
Yeah.
I'm going to bring to everybody's attention that we need to pay attention to these detox pathways, pay attention to binders, pay attention to the hydration. And then, so when you're choosing someone for removal, looking for someone who's SMART certified, and you can't really go into any doctor or dentist office. Well, I shouldn't say any. There are some that are okay with it, but they've gone to school, they have a license, they've trained, and most of them intend to do the right thing. So if you go in there telling them how to do their job, that's something else I work with people on. You have to ask questions. Let them educate you about what they do and what they need to do, because it sets up and licensed people are human too. None of us like to be challenged if we know what we're doing. And, you kind of maybe lose patience. And so some people get dentists that seem annoyed with them. And we have to remember that a lot of dentists, even holistic ones, if they have not done their own heavy metal detox, they may also have issues with their nervous system. And I know what that's like. I am not inherently an impatient person who will snap at somebody. But when I know I'm toxic, I can see it when it happens to me. So that's the other thing in finding a dentist, is knowing what you want them to do, but learning to ask the questions so that they can educate. They do like to educate you on what they do, usually, if they're good. And making sure that, you're doing your preparation, like, the prep phase of the detox we do will help to open up those ways and get the methylation working properly. And if somebody needs help with their gut, if they're suffering with constipation, I would absolutely work on that before getting the amalgam out, because the amalgam in your mouth is a source, right? But the dangerous part is all of that mercury vapor that's stored away, and and that's what the fat is for, really. It's there, it protects you, right?
Right.
So, looking at it as it's actually protecting me right now. It's holding the mercury for me. It's keeping it from causing me all these problems. Let's not disturb that until the downstream is clear and the body's ready to handle it. And that's my theory. It's like, it's all terrain theory, and we have to work on the terrain and getting the biochemistry turned back on so that we can handle the detox. And I will tell you, a lot of people ask me about various detoxes or chelation protocols. And there are some of them in which people get so sick. They go in these support groups and they start opening up the upstream and they feel like they're going to die. I even have some people who have been to doctors who have done IV chelation on them and they've never been healthy since then. They've been very, very sick. Mm-hmm. And the letters behind somebody's name does not matter. What matters is how are they approaching the protocol and how are they preparing you to handle it. And if they're not asking you things about your health and your symptom complex, your methylation, your gut, then it's going to be up to you to make sure you take care of yourself and then let them do their job, which is to remove the source of the toxin. But you have a plan before and after.
So can I ask you a question about removal? I know it's a question I get quite often is should I remove all of the amalgams at one time or should I do it in spurts?
No, you should not remove them at one time. So Dr. Huggins felt that midline should not be crossed, and that has to do with your cerebral spinal fluid flow and craniosacral movement. And he feels that you could actually stimulate some symptoms that you don't need to stimulate. So it's complex, and I don't feel like I explain it well. But what I can tell you is that based on Huggins protocol, the smart dentist, IOMT, they do not do crossing the midline. So that's the first thing. Now that does not necessarily apply to extracting a tooth. That doesn't mean a dentist can't do a filling on one side and a filling on the other. And it has to do with this galvanic response that you talked to. And for people who don't know what that is, if you have mercury in two different teeth and it's mixed metals, you have salts, minerals in your saliva. And all of that comes together and there's this interaction, and it's literally like an arcing of a, if you think of
electricity,
almost like having a battery in your head, which is kind of interesting because there are some people who feel like they get electric shocks. And I know if you have amalgams, and don't try this at home, please, but if you get tinfoil in your mouth and you bite down on it, it will shock you. So I would be really careful with tinfoil in the mouth. I don't know. Okay. Did you chew on tinfoil? How did you find this out? Sometimes you get a piece of tinfoil if you're eating like a wrap or something and you chomp down on it, you can feel that. So because of that arcing, they want to be careful. And so the dentist will take a little device and they look for the highest negative charge. That's how they know where to start. So they may not know where they're going to start removing the mouth. They shouldn't know. When you come in, they should test you that day, because like everything in the body, like blood pressure, heart rate, toxins that sit on the optic nerve, these things are fluid. It's always in motion. So it may be this 1 minute and this the next minute. So right before, they should be testing you to see where they get the highest negative charge. And that's where they'll start. If you're going for the first time and you're highly symptomatic, you really should only have one amalgam removed and see how you do. And I know it's a pain to have to go through the procedure multiple times, especially with people who are anxious, but you don't want to disturb too much if you're going to be very highly reactive to having the amalgams removed. If you do okay, then the next time have 2, maybe 3 removed. But I think removing more than 3 at one time is a lot. That's just my opinion. Some dentists will do the whole one side. I have some people who have done okay with it, but they're not poor excretors and they're not highly symptomatic.
And I think, just like you were mentioning, mercury is a toxic metal. And when doctors when dentists put it into your mouth, they're in basically a hazmat suit when they put it in. So here, if you look at the dentist putting it in your mouth, they are prepared for the hazardous material while you're sitting there in all your glory, just like welcoming it in. And it's the same thing with the removal. A lot of times with removal, they'll themselves be very geared up so that they're not impacted by the toxicity, but you may not be, right? So that's part of the reason why we want to just do one at a time, because you can release extra vapors and gases that will, just permeate the skin. You breathe it in, it goes in through the tissue. So a lot can happen there.
Mm-hmm.
Are there specific, I just want to give some people a few takeaways, because I know that it's expensive to remove amalgams. I think if you feel like your health is impacted, and even if you don't, because we're going to go over that with the cavitations and stuff on another call, that it is important to have them removed. And so, if you can do it piece by piece, but what question should someone be asking a doctor? Is it just what their process is, or do you have specific questions that you recommend they ask?
So, obviously, like we said, if they're smart certified, if they're holistic, if they're biological, usually the staff can tell you that. But once you get in front of the dentist, you can ask them just simply, can you tell me like what your setup is for protecting me? And, you don't need to know all the filters, but they should have a filtration system. So the dentist that I refer to, what I should do is I should ask him if I could go in and video all the things in his detox room and not detox, mercury and removal room, because he has a separate room for mercury removal. And kind of scary to some people because we are all gowned up with masks on, and but as the patient, you're covered too. Only your hands are covered. So we cover everything for the patient. We're ask them if they use any kind of protocol. Like if you aren't working with somebody like Alexi or I, and you're not working with an amalgam protection protocol, I think the most important question to them is, okay, so we're in agreement that these mercury fillings could be affecting my health, and we're going to replace them with a composite. And so two things that you really want to know from that dentist is, what is your setup for protecting me from mercury vapor? And that includes using binders and things like that. Or do I need to go work with somebody to help me prepare for this and detox after? So ask them because they may have somebody they refer to, but if not, you could always contact Alexi and I, and we can help you with the pre and post procedure considerations. So the other thing that you want to ask them is whether how they remove the mercury. So you don't want them to drill. They use what is like a drill, but you want them to section the mercury filling and then they pop it out rather than drilling it, because the more they drill, the more vapor. So you're going to have to be exposed to some vapor when they're sectioning the mercury filling, but then you want to make sure that they pop it out like that. So it's difficult because it also means, well, what's important to you? So as a consumer of dentistry, I would say listening to this video and then taking what we've said and go and do your research. Go to the Huggins Foundation, go to IAOMT, and look up smart dentists and just start to Google search, and find out, well, what are all the protections? But if you want to really know the protocol for protections, any one of those sites will have that on there. And like I said, I will send you the link to those. And if you want to post that,
absolutely,
do the video, we can do that. Did that answer?
It did. Absolutely. So, I just wanted to throw out there, oftentimes you and I will work together as a partnership. I like to get the body ready for the detox to make sure that the excretion pathways are opened, that any underlying issues like infections and things that will slow down the healing process are addressed. And Karen really handles the whole dental detox portion of that. So if anyone is interested in learning more about that, I'll include our information below so that you can reach out to us, ask questions. Sometimes we can refer you maybe to someone that's in your area that is qualified to remove the amalgams for you. Or if you have questions and you're not sure if this is something that's impacting you, we're happy to guide you along the way. So, and like I said, we're going to have another call coming up. Karen's just full of fantastic information. So we want to go over cavitations and root canals and all that. I mean, I just get giddy like talking about this stuff.
Well, I figure like I've been through all of it myself. And so why share it, right?
You know why I love it is that although it's not an easy process to detox, the night and day difference that most people feel when they do a proper detox is astronomical. And the amount of appreciation and joy that I see from people after they've been able to complete it just makes it all worth everything that we do. And the problem is it's not just mercury. Mercury is super toxic, but this world is very, very toxic. Every year there's about 8 to 10,000 new synthetic chemicals that are introduced into our daily living. Our bodies aren't used to this. We've got EMFs, we've got, mercury, we've got stuff on our clothes and our furniture in the air. It's everywhere. And so the best you can support your body to make it easier to live your life the way you're meant to, the happier and more fulfilled you're going to be ultimately. Any things you want to close with today, Karen?
No, I'm just like really happy to finally be doing this and, getting people who are kind of just starting this journey to a point that they don't have a negative experience from it. They don't end up, having more symptoms. They think they're doing something good and they don't have the knowledge and they make choices. And, it's not like you can't go back and clean up those things, but we don't want to make more work. We have enough toxins. I think babies are born with over 272 toxins in core blood now. And there's a man who does sauna, probably the most knowledgeable person about sauna around. He does niacin sauna. And I had a really cool conversation with him, and I don't remember the specifics. I need to go back and look at it now. I've got my list of to-dos. And he was telling me that there was research money that was just basically carte blanche given. And what they learned is that environmental toxins are the biggest load of toxins that we get. So like you said, yes, detoxing the mercury, which mercury is also environmental, but we don't think of it as an environmental toxin because it's placed to the mouth. And so doing a mercury detox alone is not enough,
right?
Because there's all of these other issues, and they're all kind of, I kind of have this image of them like a ball of rubber bands, and they just keep snapping you because there's so many issues and you can't, pin it down to one thing. Like he asked me to give them, well, what diagnoses do you work with? It's really difficult for me because we were talking about, we work with symptom complexes because the diagnosis is just a sort of like a product of all these things going on that has finally gotten to the point that we can do some kind of test and that leads to a diagnosis. But the diagnosis itself, there's stuff under that. The reason you have the diagnosis is your genetic potential for this disease was turned on.
Right.
And so the sooner you do detoxes and repair, and the detox that we work with, we're looking at repairing the cell, like all the way at the cellular level, which is where your DNA is held. So we're trying to prevent turning on the genetic potential for disease when we are getting the toxins out. It's not just, I need to flush my liver, I need to do a gut reset. There's just so much more to it. And so that's why I like I like this detox program probably better than anyone that I've seen so far. I think it hits respiration, the cellular repair, turning the biochemistry on, getting the downstream out, and then going through the upstream and doing it in a way that with our help, we can help people manage their toxin gradient so that they don't have to be more symptomatic than they already were. Hearing, oh, you're just herxing, or yeah, you're just going to have a healing crisis and you got to deal with it. Well, that's not real helpful because you feel like crap.
It's hard to get through it when you want it to be gentle so that you can still live your life. Yes. You had mentioned the sauna niacin detox, and that was the first certification in detox I got.
Did you do that? I didn't know that.
I was trained by some of the professionals from. And for people that aren't aware of the sauna niacin detox, it really started from Ron Hubbard, who was from the Church of Scientology. It's not a Scientology detox, but he really believed in cleansing the body completely. And niacin is very effective at creating a lipolysis or an excretion from the fat cell so that you can detox it using a sauna. And I've had amazing things. But that being said, the TCD protocol that you and I do leaps and bounds because it's at the cellular level. And so I think a lot of times when I do both together, the results are great. But the TCD is much easier. You're not spending hours in the sauna every day, which can be a little bit difficult to do.
You're opening a blister pack and taking it a few times a day, and that's it. And that's not all there is to it, because we don't.
It's a very detailed protocol, but yeah. But so I find funny because not so many people know about that. So I'm impressed, Kay. We've got even more to talk about.
I know. It's like we keep discovering these things. It's like we're in each other's like sphere all this time and didn't know it. But yeah, and the other thing too is that when there's no other detox program that I have found that uses testing to show you where your starting point is, and it's objective and objective testing, so we can actually look, and one of those tests actually shows you this level of fat perioxidation with the excretion of a certain thing in your urine called malondialdehyde. And so we can tell what your oxidative stress is, and are you getting better on this protocol, and are you ready to move into a certain phase of detox? So that's the other thing I really like about this program, is there's a positive feedback for people, and you see that you're making the progress. You may still have some symptoms, but it's like, oh, but look, my scores came down. And it's like, for me, when I see that, it's like, oh, okay, I'm going to keep going. But because symptoms go up and down, and we forget how things were a week or a month or 3 months ago. And so we don't always see the progress we might be making with supplements. And the one thing I hear from people all the time, they're on all these programs and they're like, I'm like, is it working? I mean, I don't know. Yeah, I think I kind of got a little bit better, but now I have these symptoms. So they're not really clued in to what's really going on, because they're not having to focus their brain on what are my subjective symptoms day to day. So I think that's one of the things about the program that I love the most.
Well, and I think questionnaires are really important, because we can do all of the diagnostic testing in the world. It doesn't always give you a good idea of how it's impacting you and your physical body and your central nervous system, your brain function. So by filling out questionnaires, not only is it a good place to start with, but maybe every month through the detox process, so that you can realize and understand these are the changes. So like you said, there may be some wavering back and forth, but ultimately the trajectory should be moving forward and going up. And so you should see an overall improvement month to month on the detox programs. So
I agree. All right. This was fun.
Thank you. Thank you. We've been trying it, just so everyone knows, we've been trying really hard to get in contact with each other. But we'll put everything in the links below. We'll set up another time to go over the cavitations and root canals and anything else that we can think of, because there's so much to talk about with this. So thanks for joining in today. Karen, thank you for joining, and have a wonderful afternoon. Thank you.
Bye.